If someone you love has been showing signs of memory loss, confusion, or changes in behavior, you're probably lying awake at night wondering if this is normal aging or something more serious. Maybe they've forgotten important family events, gotten lost in familiar places, or started asking the same questions over and over again. Today, we're going to walk through everything you need to know about Alzheimer's disease and dementia so you can stop wondering and start taking action. I'll show you exactly how to recognize the warning signs, understand what to expect as these conditions progress, and how to have those crucial conversations while you still can. I'm here to share practical insights from my several years of experience as a home caregiver, though I'm not a medical doctor, nor do I have formal certifications. What I offer is practical knowledge enhanced through personal research. Always consult with medical professionals for proper diagnosis and treatment plans. By the end of this video, you'll have a clear roadmap for moving forward. Plus, I'll share free resources that have helped thousands of families navigate this journey with confidence. Let's start by clearing up a common misconception. Many people use Alzheimer's disease and dementia interchangeably, but they're different. Dementia is an umbrella term describing symptoms affecting memory, thinking, and social abilities that interfere with daily functioning. Alzheimer's disease is the most common cause of dementia, accounting for 60 to 80% of cases. But there are other types, including vascular dementia from reduced blood flow to the brain, and Lewy body dementia involving abnormal protein deposits in nerve cells. What makes Alzheimer's unique is how it affects the brain. It's characterized by buildup of amyloid plaques between nerve cells and tau tangles inside nerve cells. These proteins disrupt communication and eventually cause brain cells to die. Alzheimer's typically follows a more predictable pattern than other dementias. It usually begins with mild memory problems and gradually affects language, reasoning, and eventually basic bodily functions. This progression spans 4 to 20 years, averaging 8 to 10 years from diagnosis. Understanding this distinction is crucial because different types may require different care approaches. People with Lewy body dementia often experience visual hallucinations and movement problems, while those with vascular dementia might have more sudden cognitive changes. Getting an accurate diagnosis from a neurologist or geriatrician is essential for understanding what to expect and planning accordingly. The diagnostic process typically involves cognitive testing, brain imaging, and blood tests to rule out other conditions. Recognizing early warning signs of Alzheimer's can be challenging because they develop gradually and can be mistaken for normal aging. However, specific red flags warrant medical attention. Memory loss that disrupts daily life is often the first sign. This goes beyond occasionally forgetting your keys. We're talking about forgetting important dates, asking for the same information repeatedly, or increasingly relying on memory aids for things they used to handle independently. Changes in problem-solving and planning skills are early indicators. Your loved one might struggle with a familiar recipe or managing monthly bills that were never problematic before. Tasks take much longer to complete. Confusion about time and place is another warning sign. This includes losing track of dates, seasons, or passage of time. They might forget where they are or how they got there, even in familiar locations. Language problems often emerge early. They might struggle to join conversations, stop mid-sentence without knowing how to continue, or have trouble finding words. They might call things by wrong names or use descriptions instead. Changes in mood and personality shouldn't be ignored. Someone typically outgoing might become withdrawn, or a calm person might become easily upset or suspicious. They might show poor judgment in social situations or with money. The key is recognizing patterns rather than isolated incidents. If you notice several signs occurring regularly over several months, schedule an appointment with their primary care physician or request a specialist referral. Understanding how Alzheimer's progresses through different stages is crucial because it helps you prepare and make important decisions while you still have time. But first, please click that subscribe button right now and give this video a thumbs up. Your engagement helps this content reach more families desperately searching for answers. Every like and subscribe means another family won't struggle in silence. Alzheimer's typically progresses through 3 stages: mild, moderate, and severe. During the mild stage, lasting 2 to 4 years, individuals can still function independently in many areas. They might struggle with complex tasks, like managing finances, but can usually continue driving, working, and socializing. Memory lapses become more noticeable, particularly with recent events. This is often when families seek medical evaluation. The moderate stage, lasting 2 to 10 years, brings significant challenges. Memory loss becomes pronounced, affecting personal history and current events. They might not recognize family members occasionally. They need help with daily activities like bathing, dressing, or using the bathroom. Behavioral changes become common, including agitation, wandering, or sleep disturbances. Language abilities decline during this stage, making communication difficult. They might repeat stories, use incorrect words, or struggle following conversations. Decision-making becomes impaired, affecting their ability to make safe choices about driving, cooking, or medications. The severe stage, lasting 1 to 3 years, requires full-time care. Individuals lose the ability to communicate coherently, control movement, and recognize loved ones. They need assistance with all basic functions, including eating, toileting, and mobility. Progression varies significantly between individuals. Some experience rapid decline while others maintain certain abilities longer. Factors like overall health, social engagement, and medical care influence progression rates. Understanding these stages helps families plan for future care needs and have important conversations while their loved one can still participate, which we'll cover next. One of the most challenging aspects of an Alzheimer's diagnosis is knowing when and how to have crucial conversations about the future. These discussions are essential, and timing is everything. The best time is during the early to mild stage, when your loved one can still participate meaningfully in decision-making. Waiting too long means losing the opportunity to understand their wishes. Start with financial and legal planning. Discuss appointing power of attorney for healthcare and financial decisions. Help organize important documents like wills, insurance policies, and bank information. Consider involving an elder law attorney. Healthcare preferences should be discussed openly. Talk about wishes for future medical care, including life-sustaining treatments, preferred doctors or facilities, and specific care concerns. Document these conversations and consider creating advance directives. Driving is often the most difficult topic because it represents independence. Rather than waiting for an incident, discuss warning signs together and agree on a plan for when driving becomes unsafe. Consider involving their doctor for objective assessments. Living arrangements need attention too. Explore feelings about staying home versus moving to assisted living. Discuss what modifications might help them stay home longer and when additional care might be necessary. Approach these conversations with patience and compassion. Break them into multiple discussions rather than covering everything at once. Focus on understanding their values rather than pushing specific decisions. These conversations allow you to honor their wishes even when they can no longer express them clearly. I want to remind you that you don't have to navigate this journey alone. Building a support network is crucial for both caregivers and those living with dementia. This includes family, friends, neighbors, healthcare providers, and community resources like adult day programs or support groups. Many families find that connecting with others going through similar experiences provides emotional support and practical advice you can't get anywhere else. Local Alzheimer's Association chapters offer caregiver support groups, and many communities have online forums for questions and sharing experiences. Remember, seeking help isn't weakness or failure. It's actually one of the most loving things you can do because it ensures your family member receives the best possible care while protecting your own physical and emotional well-being. This support becomes even more critical as you navigate the difficult conversations and decisions we just discussed, and as you continue on this caregiving journey. Caring for someone with Alzheimer's disease and dementia is challenging, but you don't have to walk this path alone. Seeking professional medical guidance is essential for proper diagnosis, treatment options, and care planning. As promised, I've created a comprehensive free resource package for families dealing with dementia. This includes a contact list template for organizing healthcare providers and emergency contacts, a curated list of valuable websites and phone numbers for dementia resources, and a detailed room-by-room home modification checklist. Download these resources free using the link in the description below. These tools have helped thousands of families feel more organized and prepared. I also recommend Navigating Dementia Together by Ellie Summers, available on Amazon. It offers practical strategies and emotional support that complement everything we've discussed today. Remember, every small act of love and care makes a difference. Some days will be harder than others, but celebrating small victories and taking care of yourself is crucial. Your loved one is fortunate to have someone who cares enough to seek information and resources. If this video helped you, please share it with others who might benefit. Together, we can ensure that no family faces dementia alone.